Everyone. Thanks for joining us. We are just going to give everybody a couple seconds to filter in here as we get all the attendees in. Happy Friday, everybody. All right. Looks like we're getting some people. Give it a few more seconds.
Sonia, is there a way for me to see the participant list?
Once you close the slides, you should be able to. The slide sharing kind of destroys the view for everything. Not sure why Zoom hasn't figured that one out yet. All right, we've got a good bunch of people here, so we can get started. Hey everyone, this is Sonia from Mettle Health, and we are with Bridget from Mettle Health today to talk about transitions. BJ is not able to be here, but we're very lucky to have Bridget instead. And something that BJ comments on every one of these webinars that I want to make sure to repeat is this is meant to be a safe space to talk about the themes that we're talking about. So we encourage you to share, we encourage you to ask questions, or if you want to just sit and listen, that's absolutely fine too. Any way you want to participate with us is great. Bridget, I'm hoping you can do a quick introduction of yourself for everybody.
Yeah, happy Friday, everyone. So happy to be here with you. I'm Bridget Sumser. I am a clinical social worker, and that's the training with which I come to Mettle Health as a counselor. I've been working in palliative care for about 10 years now, and really happy to be here with you today. It's an honor to, like Sonia said, just come and open up this space for everyone's experience and expertise. And while I'll be lending some thoughts to sort of level set, as BJ often says, I by no means am the expert here, just bringing some thoughts to sort of fuel some discussion, and really look forward to hearing from you either in the chat or via voice.
Yeah, sounds good. Bridget, if you could go to the next slide, I can just tell everybody how to interact with us. And per Bridget's note just now, sometimes you may come to these without a question, but then as we kind of go through the discussion, something will get knocked loose and that'll, form something. So please always feel free to check in with us about what we discuss. So Bridget's going to go through some slides and just kind of talk about themes of transitions in different ways. And then after that, we'll close out the slides and we'll hopefully go to you, our attendees, to ask questions or just share your experiences. And you can do this in two ways. You can raise your hand and we will unmute you and you can ask your question directly to Bridget and kind of talk it out. Or if you prefer not to ask it aloud, you can type it into the Q&A area and I can read it aloud for everyone to hear and for Bridget to answer. So again, you can raise your hand and we'll unmute you and you can ask it, or you can type it in. And again, if you would prefer to remain anonymous, that's no problem. If you want to just let me know in the Q&A to not read out your name, that's no problem on this end. Thanks again for being here, everyone.
And Sonia, did you see someone raise their hand? I just saw it just flashed on my screen.
Oh, probably. Hold on one sec. We might. No, I don't see.
Okay, maybe
anyone.
it was just a practice.
It was just a practice hand. Someone's getting ready. Yes, exactly.
Great. So again, we're here today to talk about transitions, and I've been thinking and sort of preparing to come to this space to be with you all today just about the word, right? And the definition of transition is the process or a period of changing from one state or condition to another, which maybe seems very obvious. But the thing that I feel like is so interesting and powerful and thinking about transitions when it comes to illness, when it comes to changing ability, when it comes to caregiving, when it comes to loss, is that it really exists on all levels. And that's, kind of what we'll go through today, albeit briefly, just to comment a little bit on some common things that we see and feel. But the transitions of illness are as real and concrete as it gets, meaning changes to the body, changes to routine, changes to your physical home, changes to where you live, to the most sort of ethereal and existential, meaning concepts of self, relationship to spirituality or divine, the big questions of why, right? And so it's a huge topic that I think our conversation can go in many directions, but it really exists sort of on every level of our experience. And I think the other sort of just like overarching thing that I'll comment on is that transitions around this space, around illness, around grief, around dying, no matter who you are in the puzzle, right? The person whose body is actually going through the changes, or the people in support, close or far, really happens in multiple ways. So we hear about this sort of like black and white line of like a before and after, a clear threshold that's crossed, whether that's the before and after of someone's death, the before and after of a diagnosis, but just clearly defined moment of transition or change. And then there's the transition and change that happens in these like sort of micro doses every day. And sometimes you don't realize it, and then it sort of catches up to you, and it can be overwhelming because it's not that defined moment of a before and after. And then sort of everything in between. So just a comment that transition happens in lots of different ways at different paces, and we track it differently and catch up to it differently. And it's emotional, it's intellectual, it's deeply practical and logistical. And hopefully we'll talk a little bit more about that. So physical transitions. Illness takes us through all sorts of changes in our body. And those changes in the body really inspire changes in our surroundings, right? The kinds of supports we need at home, the kind of care we need help getting ourselves or being given to. And the changes in our physical body also impact our relationships, what we're able to do, what we're able to not do anymore, our concepts of self. And it also has this huge medical component sometimes of changes that have to be managed with new medications, with devices, with more doctor's appointments. And so this incredibly intimate thing that's sort of happening of our body and in our body, or in the body of someone that we care for, ripples out to have all sort of great effects on every other level. And the experiences of physical transitions are really different if it's your body or it's in the body of somebody that you care for. And both experiences have sort of different places of control and different feelings of out of controlness. Of course, sort of from a palliative care lens, when we think about physical transitions, we really think about how can we make sure that we're tending to the symptoms that create discomfort, not with the promise that we can make everything comfortable, but can we make sure that we're tending to changes in the ways that promote the most autonomy or independence that a person may want or be interested in, and to reduce any unnecessary noise, right? So thinking about changes to sleep, thinking about changes to sex drive, thinking about changes to appetite, and then of course pain, nausea, those sorts of things. So while there's a lot about the body that changes with illness that we can't control, we do want to make sure that we are tending to and caring for the things that we can influence. And Sonia, it feels funny to just be talking totally to a vacuum. So if there's something that pops into your head,
yeah.
Don't.
Yeah, well, actually there was. I was just going to comment on what you're what you're saying was kind of about just thinking about this in aging. Do you have any thoughts on how people can kind of think about these little teeny changes, just as people get older? Like I think of my dad who, certain physical aspects as he gets older are changing, and that's difficult for him to kind of grapple with, period. I mean, do you have any thoughts on how people can think about this and kind of say goodbye to, I may not be able to move in the way I used to, or this hurts all the time? Like, are there kind of ways to cope with this as you go through life normally, not just necessarily with illness?
Yeah. I feel humbled being a person in a 39-year-old body, speaking to how folks with much more life experience than me can think about these things. But I guess what I have seen and learned from the deep wisdom of folks I've been, privileged to care from is and something that BJ talks about, I think, is this, like, a ton of suffering comes from the resisting or the fighting of what is happening, right? And so often there is, the thing that makes it hard to adapt or adjust, and sort of adaptation and adjustment sort of constantly in little and big ways is sort of like the name of the game of transitions and of change over the course of aging or of illness. The part of it is slowing down enough to recognize, like, God, this sucks. I can't do the thing I used to do, and I hate that. And I wish that wasn't the case. And acknowledging the sad, acknowledging the mad, acknowledging the grief, acknowledging the indifference or the ambiguity or the sort of range of feelings that you can feel about changes to our abilities. Just that pause and acknowledging it can help in sort of integrating its reality. And sometimes that's not possible, and you just have to rail against it, and you wait longer than maybe your kids would like to get hearing aids, because that's the control you have. So that's a little rambly, but does that sort of speak to it? It's kind of
Yeah, absolutely. And I
pausing
love
to, like,
the hearing aid
acknowledge,
example. Yeah.
pausing to acknowledge,
Yeah.
like, this sucks and I don't like it, and it's what's happening. I also think that for many people, this is like where religion or spirituality or any sort of philosophy sort of comes in and helps to mediate that. Like, what do you do when you feel out of control? What is the story about why it happens? And that can be extremely helpful. And or if you don't have that, like, starting to dig into other people's thoughts about how they cope or how they deal.
Great. Thanks.
Yeah, thanks. Good question. I mean, I can, I've been recently having this conversation with one of my family members where I'm like, but you can't hear me from the other room. Like, do you want to go get your hearing checked? And it's like, they're not going to do it till they're ready. And I can kind of remind and sometimes push in a less gentle way. But they need their time to do it.
Yeah.
So, the existential transitions, like, I won't pretend to be able to speak to them with expertise, because this is the stuff of, wise people. But changes in our capacities and in our needs bring up big questions around what we ultimately have control over and around our mortality. And it's very easy, especially if you don't feel good, and especially if you're sort of watching all of the buoys that sort of help to define your daily life or your sense of self sort of shift or ebb and flow closer and farther away to feeling familiar. It's easy for senses of hopelessness or dread, or how long will this last? How long do I have to live with this? Oof, I don't want to touch that. I don't want to think about that, to sort of come in, and to come in a little, or to come in a sort of flooding way. And so the big questions of why is this happening to me? Why is this happening now? Why is this happening to my spouse? Why is this happening to my child? And, again, this is the stuff of spiritual practice, of philosophers, of being outside, just feeling, how do I reconnect to something that feels real, that feels here, that feels present, when all of these other things feel like they're shifting and they're unfamiliar and they're maybe out of my control. And it is, the existential is just sort of like the belly of the other changes, right? It's under there. if you want to tend to it. And sometimes we don't have a choice, it gets really loud. And other times it kind of can just like stay in the distance because there's so much busyness in the other changes and managing all of the things that come up in aging and in illness. I saw a hand raised. Do we want to, Karen, did you have a question?
Yeah, we can do that. Let's
Yeah,
go
happy
over
to
here. Yeah.
happy to pause. Yeah.
Yeah. Karen, one sec. We're just gonna, you should be able to ask your question. You there?
Oh, I think I did unmute. Thank you for this webinar. I think the what you said before and after the diagnosis, there's a kind of trauma that I've experienced
Mhm.
with a diagnosis of lung cancer.
Mhm.
And I now am a stage 4 metastatic lung cancer patient
Mhm.
at Norris Cotton Cancer Center in New Hampshire. And I'm doing very well. I think of myself as a healthy cancer patient, and I'm probably delusional, but the what I call existential grip, I am not the same person that I was before my diagnosis. I
Yeah.
certainly am not the same person having experienced treatment and changing over to living with cancer and integrating it, not compartmentalizing it. I tried that, but I do have to integrate it. And I almost can't imagine the physical transition. I've looked at the beginner's guide to the end, and I think there's an illustration about the illness of cancer, which is kind of a long line, and then there's a dive.
Yeah.
And I'm thinking, I might have the type of disease that just dumps me over the precipice into the transition when I thought I was doing fine. And the existential grip that I get in is, it stops me. This image that I'm looking at is actually pretty good. If it's, I guess it's called erasure.
Mhm.
And yeah, it's kind of how I feel when I get into existential grip.
Mhm.
And I guess if I have a question, it's around my family and some close friends. I'm sure they feel that I should be picking up where I left off before my diagnosis. And I don't feel, I'm fortunate, I don't feel the burden of educating them fully about what it's like, but I am not the same person. And I have a beautiful husband, lots of support. I have a fantastic oncologist,
Mhm.
but I didn't realize how frightened I was about
Mm.
dying until I saw the first image of the very elderly lady. I say a healthy 72-year-old cancer patient. I'll
Mhm.
try to stop talking, but the existential question, I live in Vermont, so I'm glad I will have governance over my own death. I've got a New Hampshire care team, so they can't help me with that when the time comes. And I've got it on the back burner in any event, but I'm trying to live my life.
Mhm.
And it's kind of hard when I have a life-limiting illness.
Mhm.
I want to live my life,
Mhm.
but the loss of control is profound.
Mhm.
I don't know if you can find a question and all that, but I'll lower my
Yeah.
hand.
Oh, thank you so much for sharing your experience, Karen. I mean, there's so many beautiful things that you've brought to light for us through your, and sharing your experience. So really, I think one of the things that came to my mind as you were talking is that the reality is that the sort of existential threat, right? The lack of control over when we die is very real for all of us all the time, right? It's just that once you have a diagnosis, once you have an illness, once somebody is talking to you about changes in your body all the time, you can't push it away as easily, right? Sort of pre-diagnosis, walking around in what you assume is a healthy body, we can be like, I'm going to live to be that 90-year-old woman in that picture because that's my story or vision of my life. But the truth is, we don't know. And the past few years has certainly highlighted that in some different ways, just in terms of instability on all sorts of levels, socially and globally. So it's one of the challenges, and also can be one of the gifts of a diagnosis, is that wrestling with the realness that none of us know, and our mortality could kind of come at any time. It's just something you can't push away as easily once you're dealing with an illness. So that was one thing. And I think, how do we manage that gripping, as you so aptly describe? Like, it is a gripping. Sometimes for me, when I feel it, I feel like a cat clawing up a tub, right? That kind of image. Like, there's just like nothing to hold on to, and I'm trying and I'm scrambling, but like there isn't a place to rest. And so in recognizing that, and recognizing the need to rest from it, what do I have influence over? What do I have some control over? Where can I rest? And for some people, that's finding as much comfort as is possible in that space of unknowing. And for others, it's like, my butt is on this chair. I can see the trees outside. I can hear a bird, right? Like, really engaging with our senses to bring us into this moment. And we all have choice. We do have choice with how we want to reckon with that sort of real loss of control, perceived loss of control, and just not knowing, how things will go. And I feel happy for you that you live in a state where you can have access to, control over your death as you may want. And you're still living with that uncertainty as dictated by that graph, which is you feel great and like, oh shit, like, could tomorrow be the day that I don't feel good anymore? So just to acknowledge that too, there's a lot of uncertainty. Yeah. Did you raise your hand again?
Thank you, Karen. One sec, I'm gonna.
Okay.
There was also a comment that I think was really great, and that was about the vulnerability of what Karen just shared. And maybe there's something to talk about the relationship between vulnerability and transitions.
Yeah, absolutely. I think when I think about the vulnerability of these transitions, big or small, right? It's like, how do we hold ourselves in an unknown or unfamiliar territory? And one of the things, this is not pertaining to what you were talking about, Karen, but something I think a lot about, working in a hospital and helping people come up with like their plans for after the hospital is, someone will walk into a hospital room and very nonchalantly say like, okay, well, we're going to send you home with a hospital bed and blah, blah, blah. And just like kind of keeps rambling on with like all of the other logistics of a discharge plan. And the transition, the change of going from your own bed to a hospital bed in your home is enormous. It feels like a tiny detail of a care plan when there's a lot of other details around there, but it's this huge transition with immense vulnerability. Maybe the hospital bed can't fit in your bedroom. And so your bedroom life is going to move into the living room, right? Like, vulnerable, unknown. How is that going to feel? How do you anticipate that from this side of the hospital entrance? And it's just to say that these transitions ask us to be in spaces of uncertainty and not knowing, with increased need from other people kind of constantly. And that takes muscle to build comfort and familiarity. to be in the space, right? You know, I just sort of like want to footnote for a second, like, this is an enormous topic, right? Like transitions, whoa, vulnerability, whoa, exit. So like, we're just talking about like scratching tiny little pieces of tiny little bits of the surface of any of these things, but vulnerability is a capacity, or component. And I often try and think like, yes, it's dealing with these things and illness is different, but can I think back to a time in my life where I was vulnerable before? How did I deal with that? What sense did I make out of it? How did I make it more tolerable? Maybe I can't tolerate it and I need to shut it down for a sec. Yeah, I see. Okay, so it seems like there's some stuff in the chat and there's some other hands raised. Sonia, because I can't see the chat, what do you think? Should we like go through these? I know we're kind of like doing this dance a little bit differently. Should we go through the rest of the slides and open up the conversation, or you think we should kind of keep?
Yeah, one second. Let me, Diana, why don't you go ahead, because you had your hand raised while we were talking about the other themes.
Yes.
There you are. Yep.
I'm right here. So the question, I think, is best to set it by saying, I care for my 91-year-old mother who broke her hip twice last year. Mm-hmm. The first time I decided there's no way she's going to stay in a facility. I'm going to bring her home. I'm going to bring the people. I will coordinate it, because my life experience already to that point had taught me that our medical system is not okay. And so from January to June-ish, she went from, you know, the whole hip prosthesis thing into her femur and all that, to being able to dance again.
Oh.
It was amazing. So
yeah.
I come from this real life experience that, wow, because the doctors, they first said, okay, palliative care, but maybe you might want to go to hospice, because she'd had a sentinel event. So, okay, yeah. In the good old days, if you broke your hip, you die. You really do. But she came back and she was a model, because she's healthy and just beautiful. So she got dancing. I was helping her, you know, get back to what she loved to do, and that was dancing. And she broke her other hip. So she tripped. And then I heard it again. Well, your mother's had a sentinel event.
Yeah.
And then the next thing I know, you know, this fear of falling, and she really needs to just stay in the wheelchair. So the system, because I just felt I couldn't fight the system. That's how it felt. Mm-hmm. And I didn't have, you know, $25,000, $30,000 a month.
Yeah.
And so I had to accept that this is how she doesn't have control over it. She tried, my mother always moved, wiggled, getting out, and it just drove the caretakers, but they rendered her helpless. And that still is, 6 months later now. Mm-hmm. And so my question is, how to, I'm her spokesperson. Yeah. She cannot speak except for when something really emotional comes up, like, I touch her or rub her, massage her, and she'll all of a sudden clearly speak out. Mm. Oh, that feels so good. And the rest of the time she's talking and talking, but you can only understand maybe every 10th word or 20 word or whatever. Mm-hmm. So it's so hard to be the spokesperson for somebody else, and maybe talking around, that's more of the caregiver perspective. That's my question.
Mm-hmm. Mm-hmm. Yeah. Thank you. Yeah. Thank you for sharing that. I mean, so many things to comment on. I mean, what a gift that you had that capacity with the first hip fracture to help her heal and recover differently. What I thought you were going to say actually was that the second go around, you just didn't have the oomph to do that. And it doesn't sound like exactly that, like that was true. It seems like sort of systematic components kind of help to drive the change this time more. And I think, you're speaking to big issues with our healthcare system, which is like, there's so many people and the system is not efficient and not positioned to really take care of each individual. It's sort of positioned to take care of sort of categories of people. And so we hear stories lots of times where we're sort of doing our best to prepare folks for what might happen. And we prepare them and something else happens because we don't know. We're kind of doing our best to guess based on a group of people with similar similarities, but it's really impossible to totally forecast each individual's path. And that can be quite confusing for family members and for caregivers. And yeah, the experience of the difference in the thing happening to you, as in your body versus happening to someone you love, and having to mediate that and sort of advocate for and anticipate what somebody else might want, especially as they're sort of like increasingly less able to help you do that, is an extraordinary lift. It takes emotional energy, it takes cognitive and intellectual energy to interpret what you're hearing and then make that make sense against what you think that person would want. It's just a really extraordinary job. And so I don't know that I'm answering a question so much as I am just sort of validating the lift and validating the levels of confusion that can really be real in any sort of transition, and the challenge of trusting a care team a second or third or fourth time around when they misprojected or mispredicted the first time. It's just kind of like can leave you feeling like what's up and what's down, and how do I know that this is the right choice? And each of us in sort of caregiving capacities have to figure out, like, do I have a spidey sense about this? Do I have a gut instinct? How do I interpret what I'm hearing? And that's a different path for everybody. But thank you again for lending your experience to the group today, and how beautiful to try and imagine your mom dancing.
Yeah, thank you, Diana. Ridge, should we try to get through these? Esther,
Yeah,
please know I am not ignoring you. I'm hoping you can hold on to your question.
Yeah. And all of these transitions are so, we're good?
Yeah.
Okay. Okay, great. So the conversation can feel like a little circular sometimes because these things are porous and interrelated. So one of the areas that we hear so much about is changes in relationships over the course of time of illness and aging, and changes in roles. And so much of this to me lands in self-concept. So like our first speaker mentioned, like, I'm not who I was. And it takes us time to recognize that we're not the person that we were anymore. And then it takes more time or different time to negotiate how that changes our relationships. And sometimes the person we're in relationship, albeit a spouse or a sibling or a friend, a child, a grandchild, whatever the role is, we all come to sort of reckoning with what is happening differently. And there can be a lot of struggle there. If I'm sort of in a place where, like, I'm not who I was and I'm okay with that, but my spouse is really not okay with that, that can be quite painful. But learning how to be changed in the world, when you were the person who did the gardening, when you were the person who took care of all the bills, when you were the primary caregiver for someone else, right? These are big changes in our self-concept, and they're big changes in what our daily life looks like. And, you know, as I sort of mentioned before, there can be a lot of grief in that, and a lot of grief that we don't recognize because we're busy. And or a lot of grief that's just sort of overwhelming because suddenly we're not busy and we're kind of just here sitting around or not able to do as much as we were before. And I don't mean sitting around like in some sort of judgmental way, but just like we can't do what we were before. And so all we have is time to sort of think about this. You know, I think this picture to me speaks to something we see so often, which is like changes in partnership, you know, not getting to have the same amount of time or any time to really be a wife because you're being a caregiver. And it's not like those roles are totally separate, but when the caregiving demands go up, it changes that balance in terms of intimacy. And there can be a beautiful gift in that. There can be sadness. And something I think BJ and I talked about a couple of weeks ago is like, how can we find a little bit of time to connect to the part of our role or the part of ourself that was before that we're feeling longing for, if we want to. But relationships change really significantly in this space. And, you know, to that image, it kind of can be like you're going along and suddenly everything changes in this really stark way, or things are changing a little bit over time and you kind of like wake up into those changes. But lots of relationship changes, lots of role change. So then there's just like the nuts and bolts of care transitions. And it is really funny to try and like kind of talk about these things in like a stratified way, as if a care transition isn't existential, isn't relational. It's like all of the things. And I'll probably say that more times than anybody needs to hear today. But you know, when you move from focusing so heavily on trying to influence or change the course of an illness like cancer or heart disease or anything like that, and you're going to shift your focus, right? That can be a sort of line in the sand sometimes, and it changes who your care team is. It can change how many doctor's appointments you go to. It can change your sense of how much time there is left. And I think the point here for me is that oftentimes care transitions focus heavy on the logistics, which they need to, because there are things to arrange. And it's often not until those logistics are in place that it feels like there's any breathing room to acknowledge the emotional, the social, the existential things that are at play. And sometimes what I find is that if a logistic is just like not happening, something is really sticky. If we can like step back for a second, sometimes there's an emotional thing there. Sometimes there's a relational piece there. Sometimes there's just an existential, like, I can't deal with this there. Not always, because some of these logistics just feel impossible, but sometimes. If something's just really sticky, if there's a way to pause and sort of step back and say, like, what else is making this like so hard to look at, that can be really helpful. And I'm sure all of you have many more thoughts on care transitions and experiences, which I'd love to hear from. The best care team shifts and changes depending on what's happening. You know, we can talk all sorts of ideals about what that best care team would look like. And the reality is it's very different in terms of where you sit in the country, what resources are available to you. And it's hard to speak in a really generalized way. And I think if it's possible, to expand the concept of care team beyond oncologists, beyond cardiologists, beyond primary care doctors, to think about all the levels of experience that we've talked about. So is there somebody in your care team that helps you hold the existential, that helps you hold the emotional, that helps you hold the social? And that can be clergy, that can be friends, that can be family, that can be an internet support group, that can be a mental health counselor, right? Like there's lots of ways to sort of pull a care team together that isn't just like a group of people in the same healthcare system. The best care team would be able to think a little bit about all of these layers of experience of transition that are happening. So anticipating transitions and the idea of anticipating in general is tricky, right? This is a concept, anticipation is a concept that resonates more or less for different people of different cultural backgrounds, different generations. It really soothes some people to anticipate. It really scares other people to anticipate. So part of the question around anticipating transitions is, are you a person where that's going to help you as a caregiver or as a patient? And, sometimes that gets sticky. If you're a patient or if you're a person with an illness, and anticipating what's going to happen isn't going to help you, but your primary caregiver really needs to do that in order to sort of lay out what the future might hold. How do we hold both of those things? Because they're both true and they're both real. And it's probably not interesting to make one more true or one more real. And so is there a way that we can think about people having different needs around anticipation? If anticipating and sort of planning is something that's helpful to you, it can be really helpful. It can be useful to sort of think about what you may want or not want, who's around to help or not. And if there are things to do now to make some of those things easier, knowing that on a certain level, we kind of have to get there to face it, but are there things that we can have in place? One of the things you're talking about your mom and being an advocate and how challenging that can be is like, if it's in your family culture to do so, does it help to talk about what ifs and what would you want, so that if you can't tell me, I can advocate better for you, or I can just hear your voice in my head helping me prioritize the things that are important for you. Again, it's not a thing that resonates with everybody. But the first step is sort of like identifying if thinking ahead helps you or not, and how do we best support sort of where you fall in that spectrum. So I think this is sort of the final slide before we get into these comments and questions, which is just to acknowledge that this is a lot, right? It's just so real on every level of our experience, and more or less at different levels at different times, but it's a lot. And I think we acknowledge that sometimes. And I think probably many of you have had experiences of the healthcare system where it really doesn't feel like that's acknowledged. And someone just says like, hey, I think it's time to stop chemotherapy. And it's expected that you just sort of like integrate that and hear it and understand it quickly. And the reality is that these transitions, all of them influence us on so many levels that it takes time for it to integrate and for it to be understandable to us. And that can be really overwhelming. Can also be really beautiful, but it's just a lot. So maybe on that note, let's see.
Yeah, while you're doing that, let me unmute Esther here because she's had her hand up for a while.
Yeah,
Esther, you should be able to ask your question now.
Hey there.
Hi.
Hey, nice to kind of meet you.
Yeah, nice to hear your omnipresent voice.
we go. Yeah. Really, it was just a couple of comments based on what came up in previous conversation with Karen and with Diane. With Karen, it really struck me what you were saying, and really to both of you. Also, I would want to add to the chorus of thanks for sharing your experiences. It's all really big stuff, and yeah, speaks very much to the human experience that we're all having, I guess. Karen, it just really struck me when you were talking about being a different person, that this experience has changed your outlook, that something in your assumptive world, it's like having the rug pulled out from under you, if I'm understanding what you were saying, and I may not be, so I guess I'm humbly offering what I heard, or some of the takeaway, and that maybe some of the folks around you are not recognizing that in a way that supports you in feeling seen, and that can be tough. It was a comment that you made where you said, I want to live my life. So you're doing, you said well right now, which I take to mean feeling fairly healthy, I think you said, for a person with stage 4 lung cancer. And it just really struck me that what I hear and heard in what you were saying is that you are living your life. This is it. Whatever that, there might be external expectations of what that should, and I put the should in quotations, look like for other people. And what I really hear is that you are living your life. And it is all in transition. And that gripping, that existential gripping, and the existentialists sort of talk about this idea of the energy of existential angst, I think sometimes. And it really struck me, that word gripping. And I wondered, what is that gripping saying? Because I think sometimes that gripping has something to say or to teach us, like maybe it's a driving energy. So if this is our lives, this is your life, is that energy moving you to, what is it? I don't know, I just wondered, it was just a question. There's something significant in the energy of the gripping and of the existential questioning and wondering that is a driving energy. And where does that lead in this process?
I mean, I certainly think that there's like a tremendous amount of societal influence around that, right? Because I'm going to speak in massive generalizations that will certainly not be totally true in some big capital T way, right? But socially, we're not given a lot of support around how to think about or be with existential transitions. And if anything, it's like, no, we can have control over that. We can have influence over that. We can change this, or I'm not supposed to die. I'm not supposed to die at this point. I'm not supposed to be ill, right? And so it's sort of in the water to grip. Unless you're raised with a different religious or philosophical orientation, which many people are, but sort of the dominant social structure, the dominant concept in medicine is to sort of grip and to push away from that.
To put it right, I think I hear what you're saying, Bridget, to push away from that if we can't see it, it doesn't exist, that things must be very logical and concrete, and that people are here to be fixed. If there's a problem, we fix it. If there, it's not always a lot of gray area. And that brings up the idea of our fear around that. And I don't know, I mean, I think these existential ideas, or what we might call existential ideas, exist outside of the world of only religious philosophy or people who are thinking philosophically. I mean, I think it's in us all. I think it's a very human thing to ask to
Oh,
want
totally.
to feel a grip of you know, life is limited.
Mhm. Yeah, it's just a very human thing. We can put all other sorts of language around it. but it's-
And when we have a more experiential awareness of the end of our lives, whether that comes through being given a life-limiting diagnosis or having had a near-death experience or whatever it is for us, having our assumptive world, that sometimes it can be someone else's experience. When we have a little moment of having a more visceral sense
Mhm.
or an awareness of the reality of the end of things, of our death,
Mhm.
it can shake things up. It
Mhm.
can be very disorienting. However, it just struck me in what Karen was saying that it is a big transition. We don't even really know. You know, we've got all kinds of ideas about it.
Mhm.
You know, that is a pretty significant transition that is a part and also maybe not a part of life.
Mhm.
And that this process is, it just was really struck me that I hear that you are living your life, maybe despite what anyone else is saying. And that really was the comment.
Mhm. I think, thanks so much, Esther. I think another thing that kind of popped into my mind as you were talking is that, we don't expect people to get back to who they were when the transition is something that we've deemed as good, right? So someone gets married, you don't expect them to go be their unmarried self once they're married. Someone has a baby, you don't expect them to be their pre-parented self, right? If it's a transition that we've deemed as good, you're allowed to change. The relationships are allowed to change. The priorities are allowed to change. It's supported, it's encouraged. If you resist that, that's a whole other thing, right? And so how can maybe there's a way to extend that sort of goodwill that we offer people when it's a positive transition to these moments of like, of course I'm different after this diagnosis. And can we be curious about that? Can we explore that together?
I think that's a beautiful thought, because it also brings up a question around death. When did death get a bad rap? When did we start to think? No, really. I mean, I know it sounds a bit.
No, totally. I'm not laughing. Yeah.
Where did it come from? And I think that it hasn't always been around. It's
and it's not everywhere, right? Yeah.
No, sure. But and again, I'm speaking probably in pretty blanket terms. But the idea that death is a bad thing to be avoided. And that, that it's somehow aberrant, that it's somehow not natural, when really it's very, very much a part of our process on this journey. So, on that note, thank you all for hearing me. I hope some of the dialogue was valuable, and blessings to Karen and to Diane. It's big journeys, and Diane, your advocacy for your mom is really moving as well, and your tenderness really struck me.
Thank you, Esther.
I just want to leave you with that. I have to get going, so take good care. Thanks again for this, all y'all Mettle Health crowd.
Thank you. So we've got a couple more hands up, Karen and Deb. So let me just go ahead. Karen, I know you might have wanted to just comment on something that was said.
Thank you. And just some lovely feedback. And I heard the word death twice, I think, the first time in our discussion, but it's occurring to me that transitions and palliative care, I had my first palliative care appointment yesterday to add the doctor to my care team, and yet I get it. So it was a good appointment. But I think I'm going to pull away from today's webinar thinking, yikes, I'm charged with two tasks. I'm charged with adding years to my life, and I'm charged with thinking about transitions. And it's the old Chevy Chase thing, you know, it's a floor wax and a dessert topping. So what the heck do you do when there really are separate tasks? And maybe that's part of my
Mm.
grip. I think, which way should I go? Should I be reflecting on my existential, and I agree, death is natural, or am I full speed on finding adjuvant therapies, clinical trials, and adding years? And at the same time, maybe not. And I'm also thinking about prognosis, because I have not probed for a prognosis as such. And I'm thinking, when does the starting gun go off on transitions? And I think for me, it has begun,
Mhm.
but without a prognosis, I don't know what the palliative care team does. If they wait quietly in the room next door and wait for me to come through the door and say, okay, I'm ready for you.
Mhm.
It's a little confusing.
Yeah, totally. And I think, you know, it's different in every healthcare system. I can tell you that if you were here and I was seeing you as a palliative care provider, I think we would want to walk with you now, right? To say, like, do you want to talk about prognosis as best as we could guess? Does that help you feel like it lays out some possible path that then allows you to dig into these other things more or less, right? But maybe, maybe not. I don't think you should have to say, oh, I'm ready for palliative care, and which means something about something else I don't want. Like, in the best world, you could have both things. And if you like want to focus on extending your life as much as possible, that you have palliative care providers that are helping you in that pursuit, because it is a very reasonable goal, or hope. So I hope we come into a world where everyone has access to palliative care, where it doesn't feel like one thing or the other, and it's just another set of support to help anticipate, if you want, to support what's coming up now. And I think there is some world where, given that kind of support and space, sort of holding those existential questions and that not knowing makes the life you have richer, right? And not to be like trite about that, but I think that's possible. And I know we're just at the hour, and I have a baby who's crying in the other room, but I want to make sure if there's another burning question that we get to that.
Yeah, thanks, Bridget. Appreciate that. Deb, you've had your hand up. If we can get you in this last second here. Deb, you should be able to ask your question now.
Thank you so much. I know you're pressed for time here.
Yeah.
I greatly appreciate everything you said. I was really struck by you talking about different needs around anticipating transitions, and I have selected not to do any more treatment, and so I'm entering into the stage of inquiring with hospice and trying to decide when the best time to go on hospice is. And my main question is just that I have 4 adult children, and so they're all at very, very, very different stages with everything, and it's making all of this much more difficult. And I still look fine to everybody, like I look like a healthy person, and what I'm basing my decisions on is really completely how I feel. And unfortunately, unlike Karen, I am my level of weakness and feeling death inside of me is huge. So I'm very much wanting to you know, get my, I mean, I've gone through BJ's book and I have everything in order, and, you know, realizing that I'm setting up hospice and thinking of what might this be like in terms of, none of my children are local, so what kind of local support might I have? And going into like choosing green burial, are my kids going to be okay with that? You know, so I'm wanting to have those kinds of discussions with them. And yet, like I say, I'm finding that, you know, they're at all levels of denial and wondering why I'm even talking about this, or you're not really that sick, you know, all of that. So if you have any suggestions about how to have conversations with them around that. It's actually, when I signed up for this, I thought that the topic was actually difficult conversations instead of transitions, because it's so much on my mind of like how to communicate with all of them, and with them, you know, being so spread out across the US here, and in their own professional lives, and one with a child that, like, I don't know how to do this with the grace and ease. And I also don't want to ask something of them that, you know, I want to be respectful, and I'm their mom, so I'm caretaking them.
Totally.
So, yeah.
Well, I mean, thank you for bringing this, and also, like, whoa, thank you for, we're an hour and 4 minutes into this conversation, and we have not talked about conversations or communication in any sort of explicit way, which is a central component to how we understand the transitions that are happening. I guess one thing I want you to hear is that what you're describing to me sounds so normal and very common, which is that, like, it is rare to come across a family system where everybody is on the same page. That is basically just mostly a fluke. Sometimes it happens, and if it's happened to any of you listening, I'm so dearly happy for you that you find that you've had that kind of resonance. But, you know, you said you have 4 kids, right?
Right.
Yeah. It's a lot of people who are integrating it in different moments in their life. And, you know, one thing that I'm always humbled by, it's like, there's one person, whose body this is happening to, and you are 4 different people to those 4 kids, right?
Right.
And so then that's a component of the conversation too. Everybody's trying to make sense of what's happening to their mom.
Right.
Mom is one person.
And then we have two of the spouses of my children have lost their mother to cancer.
Oh yeah. So
one recently, and so there's just so many levels here. And I just, like I say, I find myself taking care of them and then kind of pulling back and like, okay, I've lost myself in this. How do I stand inside of myself? And then also just like this frustration of like, I need to be respected in here, and I want to be heard before it's too late.
Yeah. Deb, I really feel for what you're going through and talking about and describing. And I think in some ways it's too much to manage by yourself, right? Like, it's too much to manage, but maybe it's also too much to manage with all 4 of your kids. And so is there one kid, is there one friend, is there one other person that you can be having these discussions with? And then you can say like, hey, I'm having these discussions. This is what's going on for me. I'd really like you to be involved. And you got to make that choice, right? Like they will show up to what they can handle or not handle.
Oh, that's a good suggestion.
And then it will go on, that will inform their process over time, how close they could be or not be, right? And that's their path, right? And as a mom, it's so hard. It's almost impossible to separate yourself from that, but they each have their own path.
Absolutely. Totally.
And so who's a person that you get to talk to this stuff about without feeling you're like dragging them along for the conversation, because you deserve like a little bit of just supportive ease.
Right. Yeah.
And then
My husband is wonderful, and I have many
Great.
friends, and I'm actually working with BJ as well, and he's
Great.
offered to have them, come in. It's just
Yeah.
these last couple of weeks have been really, really tough because I've really taken some nosedives. So yeah. So that's a really great idea in terms of just, I think that what you just said really resonates in terms of telling them that I am having these conversations and saying, I invite you in if you want to be, and then they can really decide. Yeah.
Oh, I wish there was more time to speak to more levels of this, but thank you so much for sharing.
Yeah.
I'm glad your husband's there with you. I'm glad you've got BJ. I'm glad you've got other supports, and your kids will come along in the ways that they can,
Yeah.
I think part of the mantra there is trusting them in their own lives.
Right.
And like, they may not be able to be super close to this. It may not be tolerable for them. And it may be now, and it may be then. And that's part of the unknown mystery. And it can be painful. And it can also just be like, I'm going to trust you to be in your own life. That's my job as your mom.
Yeah. My dad's last words to me were, he sat up and took off the oxygen, and he said, I brought you into this world to live your life. Now go live it.
Yeah.
So, yeah.
Thank you so much, Deb.
Yeah, thank you. And I see some people have been sending comments, and I'm not going to have time to write back to them, but just hand in my heart. Thank you, everyone.
Yeah. What a beautiful, beautiful moment of community. Thank you all so much.
Yeah. Thanks, everyone. Thanks, Deb. Thanks, everyone, for being here. Thank you, Bridget, for going a little bit over. We really appreciate it. Yeah. So thanks again, everybody. Wishing you all a good weekend. And thanks so much.
Until next time.
Yeah, exactly. Talk soon. Bye.
Here.